Well, despite an increase in the number of deaths in our area linked to COVID-19 in today's report, as we showed you the last half hour, some recent data shows a steep drop in deaths locally over the past few weeks. Digital reporter Jeff Keeling's here. We think that's the impact of those falling cases we've been seeing.
Yeah, that's right, Josh. You know, we saw the viewing areas case rates daily start dropping dramatically around Christmas, and they've been dropping since then. But the death rate stayed high. That's a lagging indicator, about 30 days, you know. But if you look at graphic number 1 here, you can finally see that line not just going down, but almost straight down. Look at that, Josh. We hit a high in the 14-day average of new daily deaths just 2 weeks ago at 13.5. all the way down to 5 yesterday. And if you'll look, it's been since early November since the number has been that low. It would peak and then trough and peak and trough, but it never got anywhere near that point until now. So that's a very, very encouraging sign.
Boy, it sure is, and it is a drop. And we're hoping that continues. Vaccines, the hope, certainly will help with that. But let's talk about that vaccine trend in our region. We've been doing quite well when it comes to administering the vaccine, right?
That's right. I mean, compared to the rest of Virginia, the rest of Tennessee, our region continues to outperform. The Washington counties, the Tennessee one and the Virginia one, are both in the top 3 out of the 95 counties in those 2 states in terms of people vaccinated. And regionally, we're at over 14% with a first dose in Northeast Tennessee, almost 16% in Southwest Virginia, and the state numbers are quite a bit lower than that. So very, very good performance there in the region.
You mentioned last week that Virginia has been outpacing Tennessee when it comes to those first doses administered, and you've dug into the data. What are you finding here? What's going on?
Yeah, so I noticed that last week, or several weeks ago that began, and so CDC has, the Centers for Disease Control has a lot of good data, and one of the things you can tease out of that is the percentage of the vaccines that a state has received that it has administered. And if you look here, Tennessee ranks 46th out of the 50 states. It's at 71.2%. That means right now about 30% of its vaccines have not yet gotten into arms. Look at Virginia as a comparison, it's at 85%. That's a pretty wide discrepancy, and then the national average is right about in the middle at 77.7%.
That can add up over time.
It can.
Number that's getting held back. What's going on here? I mean, are you able to extrapolate how or what's happening that Tennessee's lagging behind Virginia?
Well, you know, I wanted to know what was going on. So last week, a Tennessee Department of Health spokesperson told me the state's keeping vaccines in the counties where they're allocated. He said they're sending more resources to help locations that are struggling with throughput. So if we look at graphic number 3, obviously that doesn't include Northeast Tennessee. You see here, this is first dose percentages. We're at 14.3%, Washington County all the way up at 16.9%. The state's around 10.5%, and you see a couple of big urban counties, Knox and Davidson, that are right in that range. But then you go down to these are 2 very large counties. Shelby County, 7.9%, Rutherford County, 6.6%. Well, they're trying to help those counties get that vaccine in people's arms, but in the meantime, there's doses that aren't getting administered on a weekly basis, whereas up in our area, we've got people clamoring for that vaccine.
7.9% of the vaccine in Shelby County has been sent out.
Well, they've vaccinated 7.9% of the population. That's clearly a good bit below the state average, well below ours. So it stands to reason that when you look at those CDC figures, those are the counties where it's not being administered yet. And right now the state has no plans, and they want to do it equitably. So they don't have any plans to reallocate those vaccines to places that could use them and probably put them through.
All right. Jeff's reporting online, of course, as always. Thank you, Jeff, very much. You could read the deep dive into the data right now on our website. Sarah?